Let's go live to Queen's Park, where Frontline workers are discussing new provincial restrictions on supervised drug consumption sites.
Since took office, 21,000 people have died. We went from 2 people dying a day to 9. Evidence-based treatment exists in supervised consumption services. They are already hubs with wraparound services, and we cannot remove these lifelines. They should be expanded and funded with more resources. We are in a serious and deadly toxic drug death crisis with no coordinated tables or emergency task forces to address it, with political interference and hostility based on ideology, stigma, and discrimination. Archaic drug laws and enforcement have only contributed to the ever-rising toxic drug supply. The eras of Just Say No have made the toxic supply in North America out of control. Addressing this deadly emergency crisis needs a multi-pronged approach. This includes evidence-based supervised consumption sites, compassion clubs, safer supply, decriminalization, and evidence-based treatment that is gender-specific and inclusive, culturally appropriate, public, and where the profit motive is removed so people can get the care they need without pharma and profits interfering with good quality care. SCS and needle exchange programs are essential. They save lives and they decrease the risk of fatal overdose. Neighborhoods that put in SCS saw a more significant decrease in overdose deaths than those who don't. The crime stats that the ministry used were false claims. These were not cited, did not come from the Toronto police, and no correlation was made to the actual sites. Geographical proximity is not a connection. There are other factors causing increase in crime, like the cost of living and people struggling to survive in this province. This is not about the evidence of SCS. There is large amounts of research on supervised consumption sites, and the benefits of them has spanned decades. We cannot have moral ideology and discrimination be the backbone of public policies. A few vocal critics who will not be satisfied until they are closed, knowing full well people will die as a result, should not be setting policies in this province. The government is creating a false dichotomy between evidence-based treatment and evidence-based harm reduction. One of the comprehensive responses to the drug death crisis have been supervised consumption services. We need to expand them, we need to fund them, and we need to expand them to include inhalation. The majority of people dying from the toxic drug supply are dying at home alone, and they are inhaling their drugs. We need to scale up our interventions to save lives. People who use drugs, who use supervised consumption sites, are one population of people from all different socioeconomic backgrounds who shouldn't have to die. People who use drugs have value and deserve safety too. There is nothing more unsafe than the risk of death. At the same time as they move to shut SCS, they're expanding alcohol in stores and gas stations at the cost of $225 million, associated with Ford's move to introduce alcohol in convenience stores early, more than enough to run 10 SCS for 15 years. Approximate estimate at $1.5 million per year. For example, Sudbury ran at $1.5 million and Timmins at $1 million. Closing sites will also have anticipated pressure to EMS and emergency rooms and strain on services. We already have had emergency departments in this province close, and there are days that paramedics in Toronto cannot get out to all emergency calls. Waiting 25 minutes for an ambulance to arrive in a toxic drug poisoning overdose call would be too late. People are suffering from brain injuries at high rates from lack of oxygen, and their brains during overdose are affected because it's a respiratory emergency. We have been here. In 2018, when the Ford government took office, he quickly stated he wanted to close supervised consumption and overdose prevention sites. He canceled the Provincial Overdose Emergency Task Force, which was made up of experts working together from across the province, and he defunded 3 sites in Toronto, 2 of which his government say need to now close, despite operating without provincial funding. Deaths rose from 2 people dying a day to 9. He has not invested properly in drug treatment programs, a system that needs a complete overhaul and evaluation. That system fails people every day. Hospitals are not funded properly to address substance use, despite alcohol being one of its major contributors to hospital visits and deaths in this province. The 3 reviews were conducted about SCS and the tragic incident that took the life of a South Riverdale resident in a gun-related and drug war violence incident. These reports were quietly released the day of the announcement to close sites. They were linked at the bottom of the Ministry of Health website. Nowhere in these reports do they recommend moving the sites, closing sites down, changing them to non-evidence-based abstinence models like the ones being proposed by Sylvia Jones. Last year alone, 3,812 people died in Ontario from the toxic drug supply. When we set up the first overdose prevention site in the province demanding a response to the mounting deaths, 867 people had died in 2016. In 2008, when we came here to Queen's Park, when we, the Toronto Overdose Prevention Society, put 1,287 crosses on the lawns of Queen's Park, we were letting them know that their cuts would kill, that many people had died in 2017. And if we were to come back here again and put crosses on the lawn of Queen's Park again, it would be almost 4,000 crosses. The sites have been saving lives. We have never fully dealt with the toxic drug supply or expanded services to address how people are using, like implementing inhalation in sites. And this government has failed Ontarians by not investing in the same system he wants people to voluntarily access when they can't even get into it. We all don't have $40,000 like his family. More detoxes does not solve a toxic drug death crisis. You cannot treat your way out of it. And more slogans does not save lives like bring our loved ones home. Many of us have already buried our loved ones, something I don't wish on anyone across the province, regardless of political party affiliations. Our loved ones have died. This government needs to walk back this deadly announcement and stop playing political football with people's lives. These cuts will kill. Thank you.
Good morning, everyone. My name is Naz Yadulahi. I'm president of QP Local 79, representing workers at the City of Toronto's supervised consumption sites, including Toronto Public Health's The Works and urgent public health needs sites like the one at Seton House. Today, I'm here to address a matter of life and death, literally. The Ford government's new policy on supervised consumption sites is being framed as a move to protect our children and ensure community safety. But let's be clear, this policy is not about safety. It's a calculated attempt to shut these critical sites down, which it is effectively doing. City of Toronto workers at these sites are devastated. They see firsthand the lives they save every day, the people they help, the harm they prevent. With this new policy, thousands of people in Toronto will die because of this decision. Drug users have always existed. They are people in our communities, they are our relatives, they are our friends, they are our neighbors, and they will continue to exist. The difference now is that without safe consumption sites, they will be forced into the shadows. This will lead to more needles on our streets, in our transit systems, in our parks, and yes, in the very same playgrounds that we're trying to save. Premier Ford thinks that replacing these sites with better treatment programs will somehow make things better. But let's remember, public health isn't just about treatment, it is about prevention. The science is clear. People are not going to stop using drugs simply because these sites are closed. What will happen is that they will use drugs in public spaces, putting themselves and others at greater risk. This policy will lead to an increase in ambulance calls, further strain on our public healthcare system, and longer wait times in an already overburdened emergency rooms. The ripple effects of this decision will be felt across the city, and the damage will be deep and long-lasting. To the Ford government, I say this: we see what you are doing. We will not be silent. To the people of Toronto, I urge you to stand with us, to stand with the workers who are on the front lines every day, and to stand with those whose lives are at risk because of this reckless and dangerous policy. Thank you.
Good morning. My name is Jessica Lyons. I'm a registered nurse and a CUPE member at the Moss Park CTS. I'm speaking today on behalf of CUPE Local 5399, who represents community health workers at both Moss Park and South Riverdale consumption and treatment sites, both of which will be ultimately shut down by the Ford government's new regressive policies. I want to start by giving some insight into the transformative work that happens at Moss Park CTS, where I work. In 2023, Moss Park workers reversed 517 potentially fatal overdoses, with recent monthly supervised visits of over 1,000. And we do so much more. The nursing team at Moss Park, for example, provided 116 unique individuals with primary care, including 532 instances of wound care. CTS workers connect people to this primary care. We provide vaccines. We perform testing and connection to treatment for HIV and hepatitis C. We refer and provide mental health supports. We run trauma-informed arts and writing programs. We feed people. We provide appointment reminders and accompaniments. We help people set up bank accounts. We celebrate every birthday. We help people tell their stories. We help families reconnect with their loved ones. We offer a space for people to be without judgment or shaming, to access the support and health care that everyone deserves. We are already doing the work that these supposed heart hubs are proposing, and we need more support and more funding to do our incredible work more expansively. That the Ford government, who, by the way, has never taken the time to visit one of our sites or to understand the vital health care work happening, has decided to shut it all down for political reasons is devastating news. This government, who is no friend to workers, to our hospitals, to our schools, makes decisions to please funders and developers, certainly not decisions that follow evidence-based health policy recommendations. For it has been in office, as mentioned by my esteemed co-speakers, for the past 6 years without adequately addressing the public health crisis of overdose deaths. Ontario has the highest overdose death rate in the country at around 3,000 preventable deaths annually. Since there is no part of Ontario untouched by the toxic drug overdose crisis, it is our families and our communities that will be living the consequences of Ford and Minister Jones's recklessness. We're terrified because we know that with a shadow of a doubt, this will lead to many more preventable overdose deaths, deaths of people that we work with, who have families, who care for their friends, who read books, who love to bake, who are trying to get housing, who make art, and these people matter. Eliminating sites will increase public drug use, will increase public disposal of drug use equipment, will increase the incidences of bodies being discovered in alleyways and parks, in Tim Hortons bathrooms, in libraries, and it will increase HIV and hepatitis C rates, and it fundamentally denies the right of a group of people their access to needed health services, period. We are calling on the government to stop these closures and to instead scale up a response that would actually address the crisis that we are in, which means expanding access to supervised injection services, expanding access to various evidence-based treatment types, and to address connected crises such as the affordable housing crisis in this province. And we are calling on workers in Ontario to join us in resistance, to be loud, to speak out, and to defend these vital health services. Thank you.
We've been listening to a press conference down at Queen's Park. We've been listening at Frontline workers discussing some of the new provincial restrictions on supervised drug consumption sites, expressing some of the concerns about the potential of those being shut down. We'll have more reactions to that coming up in a bit.